Good evening. Welcome to Conversations with Candidates, a joint production of Oregon Physicians for National Health Program and the City Club of Portland. I'm John Stride, City Club Secretary of the Board of Governors. Our club has over 100 years of history, producing research and public events to help Portlanders make informed decisions about public policy. You can learn more about City Club and become a member yourself by visiting pdxcityclub.org. City Club maintains a nonpartisan approach to policy. We are faithful to that approach in our participation here. It is beyond argument that the healthcare system in the United States is suboptimal. It costs more, is less accessible, and delivers worse healthcare outcomes than in other industrialized nations. But healthcare is personal to nearly all Oregonians. Congressional candidates' views on our healthcare system is an important consideration for Oregon voters. While City Club of Portland does not endorse specific candidates and has not taken a position on specific healthcare policies, we are pleased to co-sponsor this opportunity for candidates to present their perspectives on healthcare policy to Oregon voters. We thank Eddy Morales, candidate for Oregon Congressional District 3, who graciously consented to talk about healthcare policy tonight. And now it is my pleasure to introduce Paul Gorman of Oregon Physicians for a National Health Program, our moderator for tonight.
Thank you, John. Good evening. My name is Paul Gorman. I'm a member of Oregon Physicians for a National Health Program, or PNHP. Our group advocates for single-payer healthcare, also known as Medicare for All. Our website address is www.pnhporegon.org. We want to thank you for joining our Conversations with Candidates 2024 speaker series, in which we offer Oregon candidates for elected office an opportunity to talk about healthcare. Before I introduce tonight's speaker, Eddy Morales, I'd like to tell you about single payer and why we at PNHP advocate for it. As John just mentioned, Americans and Oregonians pay twice as much for healthcare as people in other developed nations, yet our health outcomes are at the bottom of the civilized world. Americans pay more money, get less care, and cover fewer people than any other nation. We believe that any healthcare policy in our state or country should achieve three goals. First, everyone should have access when they need it. Second, total costs must be lower. And third, health outcomes must be better. The bumper sticker version of that is better care to more people for less money. Across the world, there are examples of health systems that achieve all three of these. What all these successful systems have in common is, first, everyone's included. Second, everyone enjoys a single comprehensive benefit package. And third, any patient can see any provider. The most efficient method of doing this is a single payer system, publicly financed, privately delivered universal care. However, not everyone agrees with this. To allow you, our audience, to hear different perspectives on this challenge, we've invited candidates for major parties who are running in one of Oregon's contested congressional districts to explain how they think about healthcare and what policies they endorse. Please note that a candidate's appearance in our series does not constitute either their endorsement of single payer or our endorsement of any candidate, either by PNHP or the City Club. Tonight, we're honored to have Eddy Morales to represent a candidate to represent the Congressional District 3, who will share his thoughts about healthcare in this evening's session. After Mr. Morales speaks for about 20 minutes, we'll have a question and answer session for the rest of the hour. My role as moderator will be to facilitate the conversation between the candidate and you, the listeners. Please feel free to chat with others in the audience using the chat function. But to submit questions for the candidate, please submit your written questions using the Q&A button. I will ask as many questions as time permits. Please keep your questions courteous and pertinent. Eddy, thank you for joining us, and the mic is now yours.
First of all, thank you so much, John and Paul, PNHP and the City Club of Portland for the chance to connect with your audience and to learn from your audience as well. I used to be on the Portland City Club's Friday Forums Committee and know how much work goes into putting these on, and also how much impact these can have in terms of getting information out to people. So just really want to appreciate you all. I want to start my time with you by focusing on my story. My mother came to this country in the trunk of a car. And 37 years ago, she brought us to Oregon. This time, she was fleeing domestic violence. The time before that, she had my 8 siblings in the backseat of strangers' cars when she came to the country. But both times she did this to ensure that we had a better opportunity, that we would be healthy, and that we would be safe. She did this to ensure that our family would remain together. Once we were in Oregon, I became the first in my family to graduate high school and to go to college. And in college, I learned how to organize by joining farm workers in a boycott to demand better wages, and we won. And in that moment, I knew that workers in this country could have power. When I was in college, my mother had to flee back to Mexico to be with my ailing grandmother. But she wasn't able to return back to the United States and ultimately passed away there. And in that moment, I learned that our country desperately needed immigration reform. Since that time, I've lost 2 brothers to gun violence and a sister to addiction. And in those moments, I learned that we desperately need to address public policy around safety and addiction. These are the reasons why I've dedicated the last 24 years of my life working with people to make concrete improvements in their lives. I've worked in Oregon and across the country on the Affordable Care Act, comprehensive immigration reform, electing progressives to office, and supporting organizers across the country in their fights. Whether it was believing Stacey Abrams that she could turn Georgia blue and supporting her for the last 10 years, or standing with Desmond Meade to restore voting rights for over 1.5 million returning citizens, or supporting the community organizers in Arizona to remove Russell Pierce and Joe Arpaio, who tormented immigrants. Every single time I went and organized with these communities to make change. I started to organize here in Gresham after my mother passed away. And that led me to run for city council. And in the city council, I've been able to work on the issues that are tearing working families like mine apart. I'm dedicated to keeping families together, safe, and healthy, just the way that my mom did, by digging in and finding solutions to affordable housing, addiction services, public safety, creating good paying jobs with health insurance, affordable and accessible healthcare, mitigating how climate change affects us all, and guaranteeing and expanding reproductive freedoms and abortion. My community is ready for me to run for federal office so that we can take the work that we've been doing here in Gresham and make that available to others. Because what's worked here in Gresham will work for Oregon, and what has will work for Oregon will work for this country. I want to just also share a little bit about my personal relationship to this particular issue. I've shared a little bit about my family's impact. But my time of service with particularly healthcare started back in 2004. 2004, when I first moved to Washington, D.C. right after school. And I got to serve on the board of Choice USA with Gloria Steinem. And we taught the history of abortions and reproductive health care to students across the country and advocated for better reproductive health care. I've also been working with Planned Parenthood to ensure that people on the eastern part of this district and in East County have access to reproductive health care and helped to open 2 clinics, one in Ontario and one here in East Portland. And also worked with a coalition of organizations, reproductive justice organizations, to defeat Measure 106, which would have rolled back reproductive rights in our community. I also serve on the board of a group called Community Catalyst. It's a national organization that whose mission is that we won't stop until everyone has what they need to be healthy, and our health systems are shaped by and accountable to all people. We have been funding and supporting Medicaid expansion fights in the American South. And furthermore, I want to share this story because I think it's one that many times gets lost and is very important for anyone who approaches healthcare through an equity, racial justice lens. Growing up, my health insurance was going to the emergency room. We didn't have preventative care. And I do think in Oregon, we've made progress through the Oregon Health Plan and now allowing immigrants to also access healthcare. But people of color have less access to healthcare and live with higher risks. Many times, they have harder jobs that are physical and unsafe jobs. They live in places where they don't have access to clean air, clean water, or healthy foods. They don't have access to the outdoors and public safe spaces, and don't have quality jobs that provide the benefits. When we talk about healthcare and when we address healthcare, we have to address it through the intersection of how all of these social determinants of health impact one's healthy and well-being. In my own family, I mentioned that my sister passed away from opioid addictions. She was a factory worker here, a line worker here in Oregon, and her shoulder blew out. She was prescribed opioid medication for the pain. She became addicted, and we lost her. Had we had a more comprehensive health care system and network, I think she would still be here. She would have received the services to handle the addiction, and we maybe wouldn't have been as quick to prescribe opioids as her solution. I also believe my mother would still be alive these days if she had access to high quality healthcare. See, my mother was asthmatic, and at one point, because she was living in Mexico, was housebound because she couldn't be around the bad quality air around her. That deteriorated her health. When I came out as a young person, and so did my trans niece, our community was really poorly informed about HIV and AIDS, and only stigma made its way in our communities. As members of the LGBT community, we have feared for our lives, not only from hate crimes, but from medical issues like HIV, that at times seemed like a death sentence if we were to contract the virus, and that we also felt political leaders did not care enough. Unfortunately, my trans niece contracted HIV and has been living with it. Thankfully, HIV healthcare has significantly improved, but people living with HIV may not be living if they did not have access to community-based health centers, medicine, tests, and ongoing care. My own inadequate dental health care and preventative care growing up led me to spend tens of thousands of dollars to correct related dental issues that could have eventually created bigger health issues for me later. I've learned about struggles with healthcare from my community, my family, and my experience, but also from the provider standpoint, because I have a really unique perspective these days. My in-laws are both retired surgical nurse and a retired orthopedic surgeon. And they shared with me the real life stories and choices that people who come under their care have to take, including my brother who was shot. And unbeknownst to us at the time, my mother-in-law was part of his trauma team. My father-in-law in his private practice lowered costs and sometimes provided free services to patients in need and did house calls to many. My in-laws, like many other healthcare professionals, didn't go into this field for the money, the recognition, but because they are committed to the health of their communities. I saw the effects of successful and unsuccessful cases with their patients and how emotionally connected they were to their work while remaining consummate professionals. I've had to console my mother-in-law when she comes home from work after losing a precious infant patient due to heart defects. I'm committed to restoring and improving the ACA, Medicare, Medicaid, CHIP, and to work towards a single-payer healthcare system that will protect workers who have already negotiated premium coverage and raise the quality of care for everyone else to match while reducing the overall cost. I'm excited to be here. I'm excited to have this conversation with all of you. And I'm grateful that I got to share a little bit of my background and my personal experience on this topic.
Thanks, Eddie. Thanks for sharing all of that information and your personal story and your strong commitment to social justice issues and the other things you mentioned. I want to turn this over now to the questions, and I'm going to look to questions from the audience, which will be submitted through the Q&A button. The first one on this list is this one. If everyone has access to healthcare that is free at the point of service, won't healthcare costs go up?
Hi, Paul. There are obviously several proposals, right, that are introduced and floating around. And I do believe that there is a scenario where there are enough people paying into a system that we can increase the quality of care for people and lower the cost. I think it is going to probably a transition over time will involve and require an investment from the federal government and upfront. But I think ultimately we will get a better system, more coverage, and more affordable, high quality care by moving towards a single payer system.
I see. Okay, thanks. The next question on this list is this one. How can we reduce the churn in insurance coverage as patients move from one employer-sponsored insurance plan to another, or to Medicaid, or to the exchange, or to individual insurance?
Yeah, I can tell that you have a group of people who are supporters of a more streamlined, simple, high quality, affordable healthcare system that maybe is a single payer, right? That creates it. And I know in the initial ACA, there was a significant amount of resources that were committed to outreach to communities to get them enrolled in healthcare. I know that the Trump administration really cut that back. I think part of the work that we have to do is continue to support those types of efforts that reach out into particularly communities that are hard to reach, and help people facilitate and navigate through this complex system. In the short term, I think initially a move to a more streamlined single payer system helps to alleviate that. If you have, companies, individuals, Medicare, Medicaid, all paying into sort of one streamlined process, I think it creates simplicity for the consumer or the end user, which I think should be part of our goals and our policies.
Okay, thank you. The next question here, as an Oregonian, in your view, what is Oregon's single biggest problem when it comes to healthcare?
Sorry, can you repeat that one more time?
Yeah, what is the single biggest problem in healthcare for Oregon? What is our number one healthcare problem?
I still think we struggle with reaching hard hard to reach communities, and making sure that folks are covered and are able to access preventative care as well. Like I said earlier, for a lot of our communities, the emergency room, it has been our health insurance, our health coverage. And obviously, that is so expensive for our communities because it spirals us into missing days of school, missing work, and has all these other effects. I think the other big piece for us is that we haven't done enough to realize that health also involves all of these other determinants, right? Clean air and water, like I said, having stable and safe housing, access to the outdoors, safe and efficient public and active transit. And so the work that we need to do around that is important. The other piece around this is addiction and mental health work. We have a lot to do. I serve on the board of the University of Oregon Alumni Association. I'm really proud of the new school and the new campus that is here in district to really prepare much more mental health professionals for the field. And I also think another big issue here is the pay. We have to pay people to do this work. And there have been moves to and under investments in getting people into particularly like nursing, into these schools, into these programs, nursing programs, to prepare them for these careers. And some of this work has been outsourced, right? Particularly, we saw that during the pandemic as people became traveling nurses. They were able to make more money living and making those trade-offs of maybe not having employee-sponsored healthcare because they were making more. And so I think we need to make sure that people are getting paid for the work that we're expecting them to do.
Okay, thank you. That's a good, here's a segue. You've already sort of addressed this a bit. If there's anything more you have to say about mental health services, the question here is, access to mental health services in Oregon is among the worst in the country. What can we do about that? And you just alluded to some of that.
Yeah, well, continuing to make sure that it is covered in our healthcare premiums, and try to reduce the so that reduce the amount of resources that we have to pay before it becomes part of our premiums. I see well, not recently because I've been too busy, but I normally see a therapist, and it's expensive. And a lot of times it's not until you hit your threshold, sometimes in 1,000, 2,000 that gets covered by your insurance. And so I think we need to take a hard look at how that is covered in our healthcare system. Again, I think we need a larger supply of people in this profession. And again, I'm really proud that we were able to launch this new school to get more people ready for these professions as well.
So we need to train more people, pay them better so they can practice, and understand that access means more than just having insurance. It means co-pays, deductibles, and co-insurance allow you to actually get the services.
Yeah. I mean, I know a lot of people that won't do it because a $200, $250 session is really not within people's reach, right?
Yeah, that's a big bite. I want to remind those in the audience to use the Q&A button and submit your questions for Councilor Morales. Just click the Q&A button and enter your questions, and we'll get them posted on this site that I'm reviewing right here. Next question. How does firearms access affect the public health in the United States?
Yeah, absolutely. Paul, I shared, and to whoever asked the question, my personal story. I've lost two brothers to gun violence. Both times, it was someone who would not have qualified to have the guns in the current statutes that we have. I think that there's still work to be done, right? Here, and for a while I was part of the Oregon's common sense gun law coalition here, um, you know, requiring background checks and enough time for those background checks to clear. I think putting a longer wait time from the minute you are background checked and qualify for a gun to when you get it. You know, I no one should feel like they can walk in and need to get the gun in that moment that that they're making the purchase. So I believe in longer wait times. So there's still work to be done here. And again, it's all to me, and I think that the point that this person is getting to, who asked this, is that those are all social determinants of health, right? You can be healthy and live in a place where you're not safe. And you know, both of my brothers were young. They were in their teens and 20s. So you know, people would have thought of them and seen them as healthy individuals, but their health and their lives were actually compromised by gun violence.
I'm so sorry to hear about your brothers, by the way. Very, very sad. The next question I have for you, what are the steps that Congress can take to help create a universal health care?
Yeah, you know, again, your audience already knows this. We have a system, Medicare, right? And we saw some investments and growth in that. I know that there are debates to lower the age. Right now, there's a gap, and I think the closest thing we have is Medicare for all and Medicaid. The gap are the people who are making just a little too much to be covered by Medicaid, but maybe not hitting the age requirement of 65 to be covered by Medicare, right? So there's a gap of people that are not being served. I think we need to, I think we need to focus on where those gaps are. I think we need to restore the ACA to where it was initially intended and make the improvements there. I think that many times in Congress, the debate gets into where our North Star is, and we start there, and sometimes lose sight of the small, I wouldn't even say small, but of the gaps. And so I do think earning goodwill, showing the impact of this by focusing on the gaps is a thing that we can actually accomplish. A lot of the pieces within the ACA have been very popular. You know, Republicans during Obama's administration tried 60 times during that time frame, what, 6 years, to repeal it unsuccessfully. And so I think that there's a structure to build from and to continue to build the public will and the will in Congress to start making moves to a more single payer healthcare system.
Sounds like you're saying we should, I'm restating what you said
Yeah.
to see if I understood it, that we need to build the public will to get to universal care, but along the way, do what we can to fill in the gaps by using the programs we have and expanding them where that's possible. So that essentially it like ACA.
Yeah, and I will say not just the public's will, but also the people in Congress too.
Yeah. Okay, the next question on the top of the list here is, why do you think a single payer system can make our society healthier and at least as good as other developed countries?
Yeah, you know, right now, about half of the people who are covered are either covered through Medicare or Medicaid. The other 48% are covered through an employer. And then there's a percentage that are covered on their own, some through veteran services. There's still gaps again. And the way that our current policies are set up, there are limits, either age or how you get your health care and what your employer or your service provider is able to negotiate on your behalf. And again, then there are people who don't qualify for any of that. So by having a single payer system, you know, you're collecting the funds for that through a tax system that everyone's paying into, right? That will, I think, eventually be cheaper than people paying monthly premiums. So you get rid of the monthly premiums, you are paying in through your taxes, and you're able to cover everyone. So just for that coverage nature alone, I think you get a better system because you have more people paying into it. You get, I think, a better system as well. And so
Sounds like you're saying a larger number of people paying into one large system will make it more affordable or more accessible.
yeah,
As well as
and you can set equitable ways for people to pay into that system, right? Right now, it's not based on people's income or their or right or and so what if some people paid a little more?
Well,
What if, yeah,
equitable is a great word because that's the next question.
it's
If
like
we cannot,
I'm being teed up here.
yeah, because if we cannot achieve universal access to healthcare, how do we decide who gets access and who's left out?
I think again, I think that that's our North Star is to ensure everyone is covered. I think we have to look in this moment, we have to look at who's not being covered or who has less than great quality, healthcare and start there. A lot of us are already on a system. Again, we're getting healthcare through an employer or through, the ACA or kind of privately, and there are still people that are in the gaps. And so I would start the work and the focus there. I've always believed that if we create policies targeted at the people who are the most disproportionately impacted by an issue, it sort of raises all boats, right? And so, and I think that a lot of those individuals are living in the gaps that I talked about earlier today. And so we should be expanding, our Medicaid coverage. We should be, I think, working to lower our Medicare coverage age. And we have to look at the information and also look at all of these, social determinants of health and see how we're addressing those in our sort of strive for health justice.
Okay. The next question on this list, do insurance companies have a future in gaining access to healthcare in the United States?
Yeah, I mean, the Colin, whoever asked that, the proposals that I see, and I think that I, do not remove them from the equation, right? You will still have health care companies. You're just negotiating instead of on your own or by yourself through government in a single payer system. And I think when you're able to do that, you're able to negotiate much better rates. You're able to negotiate better quality. In some ways, you're helping to eliminate some of the competition that has led us to an increase, many times much more than inflation, and made this so inaccessible to people, right? When we passed the ACA, and like I said, I worked on that. I was living in DC at the time. What over 20 million people who came onto our health insurance system.
Something like that.
Yeah. And, slowly, we've chipped away at that, particularly under the Trump administration. But even now we have more people covered than we did. And I think the insurance companies are doing just fine. Our premiums just went up, right? But if you're able to then kind of streamline that and everyone is able to see the options and have access to these options, I think you start chipping away at that. at the competitive nature that drives cost up. And I would say sometimes quality down.
Mhm. The next question on the list here, someone wants to know, will Americans tolerate the huge increase in taxes required by a single payer program?
Yeah, Paul, I feel this. I live in Multnomah County. We're the second most expensive county in the country is something that I read recently, next to New York. Uh, we are being taxed for and additionally on property taxes here. And I know a lot of people, particularly in my community, that are having a hard time keeping the homes that they've already paid the principal off of because of the taxes increases, and they're on
Wow.
set incomes now. So I don't take the taxing lightly, but I believe that having people pay into this through the tax system who are already paying it will probably be paying less than their premiums now. Also, you're asking companies and higher earners to pay more into it, which I don't believe. We're already, they're paying enough. And so I don't think that this will be more expensive than the current rates that people are paying.
Oh, okay, so you think that the cost will not be increased
Yeah, I think,
overall?
I think it'll require an upfront investment, but I do think in some of the studies I've seen show that eventually, right, this is like a $4 trillion industry. And some of the figures I'm seeing are like from proposals, like that maybe Senator Sanders or Senator Warren would require like a $10 trillion investment up front. But those sort of kind of tear off and end up bringing down the cost for everyone when you have a way.
Okay. Another
Also,
question.
sorry,
Go ahead.
Paul, the other thing is there's so many administrative costs right now, right? By having all of these different there's many administrative costs. It's very complicated for people to keep their care. Moving more towards a single payer system also reduces those administrative costs, and I think those get passed on to the
Consumers.
consumer. Yeah.
Yeah, got it. Here's a question. What else should Medicare cover other than its current benefits, which the asker says are inadequate?
Yeah. I believe dental, right? Probably needs to also be included. And I know that it covers prescriptions, but I think we have work to do in terms of keeping prescriptions affordable. And so, but
Well,
yes, I would.
actually, that's the next question. What can be done quickly to reduce the cost of prescription medicines?
This is not planned. These are not people that I've planted either. But I love that we're vibing here. I think allowing for people to access drugs from pharmaceuticals from Canada and other countries that produce medication at lower cost, I think is a move that we can make to bring those costs down. I also believe, having Medicare be able to negotiate pharmacy rates, I think will eventually bring the rates down too, because it creates a competition.
Okay.
And so I think those things can happen pretty quickly.
Okay. Medicare negotiating prices. So the next question here is, how can poor Americans without jobs get health care without risking bankruptcy?
How can poor Americans get a job? No, sorry.
Poor
With a
Americans
job.
have no job and no health care. How can they get health care without risking bankruptcy?
Yeah. And again, in the immediate, like I said, I think working towards a single payer system, in my opinion, is sort of the North Star for now. And there's a lot of proposals, but in the immediate, I think expanding Medicaid I think, and we did that with the ACA, right? By increasing or I guess decreasing the threshold for incomes to be eligible to it to receive Medicaid. So I think we have to continue to expand that and make larger investments in Medicaid and expand the coverage there.
So Medicaid expansion to reach that gap
Yeah.
group. So the next question that's up here is, how can we stop the bankruptcies among rural hospitals in the United States?
Yeah. That's very interesting. And I know that in some places, and like I mentioned earlier, right, with our work at Planned Parenthood here, we opened up a clinic to actually provide services that are more accessible. Because there are a lot of people who are in more rural parts of our state that don't have access to healthcare or clinics in.
Yeah.
And so I think looking at community health centers, I think in my example, Planned Parenthood, but others, and figuring out how we can invest those more so to reach these communities. I don't know that they all need a large system. I wanted to share one example though of something recently, because here in Gresham we have the Legacy Birthing Center, and it was at risk of closing, which would have meant that anybody going into labor would have had to travel into Portland. I think would have been the nearest place, or like Sunnyside.
Right.
To me, that was an access and equity issue, right? At the same time, when we already know that our ambulances are stretched thin, so is our fire department. So it just would back up an entire system. We organized here in Gresham and were able to keep that center by talking and demonstrating the need for more equitable and accessible access to clinics. So I think we need to ensure that resources are made available to community-based health centers, and that as part of our DEI or equity work, that we're also addressing head-on investments in rural communities.
Okay. There's a question here that says, so much healthcare is delivered at home by underpaid home aides. Any way to help provide care outside of hospitals?
Yeah. Well, and Paul, here's another thing I'll say is that I think we need more and this is to both of these questions, but mostly to the last one, is that we need more transparency in our healthcare system. You know, lots of money goes into the system, and where does it go? And what does and where is it covered? So I think what I'll be able to do is, in Congress, bring together the stakeholders and take leadership from community on what are the best paths forward in our district. In terms of workers that are providing services at home, I'm a very pro-labor supporter, and I know that there are efforts in Congress to allow people who are providing kind of independent work to be able to join a union, and then even if they're on their own, join collectively with other professionals to demand better wages, to demand better safety conditions and benefits for them. So I would love to see the PRO Act actually pass through, allowing for people who are independent workers to be able to still join a system that provides that. Again, in this last presidential administration in Trump, a lot of the things, the medical or professional cost of an independent worker were removed, so we were able to write things off, like uniforms or travel. I would work along with labor to reinstate those, so that people who are doing that independent work. So I would say a combination of those two would support better forms for independent workers to join other efforts, and then ensure that the benefits that we do have available for your traditional W-2 9 to 5 workers are extended to independent and independent contract workers.
Okay. Okay. The next one, what can you do in Congress to achieve bipartisan healthcare policies?
Yeah, I don't want to sound like a broken record, but currently on my city council, we are a very diverse group of elected officials. We have the range from more conservative Republicans to very progressive Democrats. And when we focus on the problem that we're trying to solve and really engage with our community when we have to face our community, and we do that, and we bring people who are directly impacted by the issues that we're trying to solve to the table, and the people working directly with them, we actually agree many times on the actual solutions that we could get done. I think that, and I know that the country is divided more so than it's ever been. I think poll after poll, data after data shows this is the most divided our country has been. I think we have to start getting back to the real specifics of problems that need to be solved, engaging communities that are impacted by those problems, and experts and stakeholders, and start to get to solution. And I think in this area, those are those gaps that we talked about.
Okay. Okay. Along similar lines, who will you look to for guidance on congressional healthcare policies?
Yeah, I will say I have enjoyed learning from Senator Warren and Senator Sanders, also Congressman Ro Khanna in California with his most recent idea, with his most recent introduction of a bill to allow states to do a form of universal health care. I think that there are people who are innovating and innovating from a place of need to fix the system that have really great ideas, and so I've had a chance to sit down with Senator Warren and hear more about her ideas, how they came to be, and I would continue to do more of that with those two senators in particular.
I see. So especially folks that have innovative ideas for ways forward.
Yeah.
Okay. Can we devote tax revenue to healthcare when we need support for schools and other social services?
Can we do? Yes.
Can we devote more tax money to healthcare when we need to use the funds, when we need funds for schools and other social services?
Yeah. I think yes. I think it's all of this. And I think what particularly this year here in Oregon, we have one of the largest kickers, right? I think we probably should look into the kicker and see whether those types of investments, when we do better than expected here in Oregon, gets reinvested into these areas. And then again, I think our healthcare budget federally is like less than 10% or around 10%. This is about keeping people healthy, keeping healthy people continue to go to school, continue to work, continue to provide and be contributors, and vice versa. The surroundings in which they live also impact their health. So we have to address this in a really intersectional way, and not make these false trade-offs that I think.
Okay, so
are
it's a false choice. It's a false choice in a sense then to choose.
When you look at when you look at our entire budget, yeah.
Are there better ways to improve access to healthcare other than single payer? Someone wants to know.
Yes, again, I don't want to sound redundant, but I think expanding, Medicare, expanding Medicaid, um, yeah, and those are not just expanding the investments there, but again, lowering the ages, lowering the requirements and the thresholds towards increasing the reimbursements, as
Uh-huh.
well. So those are things that we can actually get done much sooner, I think, than and that lay the groundwork for us to get to a single payer system.
Uh-huh. Okay. Um, what role does housing play in our healthcare system?
Yeah. Uh, you know, housing to me is one of the key pillars of not just someone's health, but someone's economic security too. And and people can um, keep stable jobs, can keep, up with their education and uninterrupted education, can maintain a network around them, whether it's healthcare providers, um, you know, d- uh, counseling, if they have stability in their housing. Growing up, I think we moved 13 times by the time I was in high school. And so every year, every 2 years, we had to pick up and leave and move. And one, the traumatic nature of displacing somebody from a community over and over, the toll that that has on people. Um, it took me it continue. I say it takes us a long time to undo that.
Yeah.
But again, when we were able to get the Oregon Health Plan growing up, um, so many times those moves were across state lines because it was cheaper to live at one point in one place, or somebody had an extra room where they would take my mother and I in. It was unsettling to it kept us in poverty, and it kept us from being a healthier family, because we couldn't keep a stable job, because the job that we had in one place wasn't enough to pay the food and the rent. It kept interrupting my education and my learning.
Uh-huh. So
Um,
unstable housing is a huge, pardon me for summarizing, but we're getting close to time. So it sounds like unstable housing is a huge drain, a huge impact on just trying to get through life. Because you got this extra
yeah, it
energy
creates
going
it creates
into.
it creates more vulnerability for sure for communities that are already vulnerable.
We're just now coming to closing time. Let's try one more question and then we can close. Should universal health care start in Congress or in individual states?
Yeah, I think I believe that if we are able to pass federal policy to allow states to do this, and there are states that are ready to move forward with it, I think they should. Right?
Okay,
I think
so
it's
states
a
first.
well, if we're able to do that, I have a hunch that there will be states that are more ready than the entire country to move forward on that. I still think it's a proof point, right, for a federal policy. I don't think that we should be stuck there or compromise or just be content with staying there.
Okay. I want to close. I've got a comment from a viewer that I want to read, and I share this sentiment. Thank you very much for sharing your and your family's lived experience in difficulty accessing healthcare, which makes clear your deep commitment to equity in healthcare. And Councilman Morales, I want to thank you for sharing your ideas and your thoughts on healthcare and other issues, social justice issues with us and the audience. Would you like to tell the audience how to reach you or your campaign if they have additional questions?
Yeah, thank you, Paul. And I just want to say thank you to your listeners and participants today for really seeing the connection of healthcare and being healthy with all of these other issues, right? Because I think a lot of times people miss that mark, that housing, climate, gun violence, safety, those all impact someone's health. And so I just wanted to appreciate you all. Please keep following our campaign. Sign up to get our updates. We put out really great policy through them, as well as more stories about stuff that's happening in our community. And it's www.eddymorales.com, EDDYMORALES.com. And again, thank you so much.
Okay, thanks, Eddie. I regret we didn't have time for all the audience questions. Remember, your registration for this series allows you to visit all the conversation with candidates on the series of next several Tuesdays. Visit www.pnhporegon.com for the schedule and to learn more about PNHP. I want to turn it over now to John Stride, our City Club host, to close the evening.
Thank you, Paul, and thank you, Councilor Morales, for sharing your thoughts on our healthcare policy. We especially thank our audience for engaging in this important discussion. And finally, we thank our co-sponsor, Oregon Physicians for National Health Program, for arranging this forum. I encourage everyone to visit City Club's website at pdxcityclub.org to learn more about us at City Club and where membership is open to everyone. Please join us for similar programs as the one we had tonight in the next 5 Tuesdays. So January 30th, the program will be with Jamie McLeod-Skinner. February 6th with Janelle Bynum. February 13th with Maxine Dexter. February 20th with Lynn Peterson. And finally on February 27th with Shashila Jayapal. Everyone stay safe and don't get sick out there. Have a good night. Thank you.